Let's now turn to the big focus story. It's the first homegrown vaccine against cervical cancer for the fourth most prevalent cancer in women across the globe and the second highest cause of cancer among women in India. An indigenously developed vaccine made by Serum Institute of India was announced by the CEO, Adar Poonawalla, who vouched for the affordability and effectiveness of the vaccine. The vaccine was officially launched by the Union Minister of State Science and Technology, Jitendra Singh, earlier today. So like I mentioned, this is a vaccine developed by Serum Institute of India. Girls between 9 and 14 would be eligible for it. If missed, then they can, of course, take this shot up to 26 years of age. 6 to 12 months gap between two doses is what is prescribed. And of course, this targets prevention of cervical cancer. It prevents HPV, which causes the cervical cancer. That's the technical term for it. The vaccine is to be priced between 200 to 400 rupees. It will be available by the end of this year. So that's largely the basic information on this vaccine. So viewers would be interested to know on how safe is this vaccine, whether it would have any other side effects. On that, let's put out the information on our screen in terms of graphics as well. On the effects, on how safe the vaccine is, well, no serious safety concerns that is there with this particular vaccine. There are mild side effects like fever and nausea. This is as per the National Cancer Institute. So that is in terms of how safe the vaccine is. Next, we would also like to tell our viewers about whether there is a possibility of this particular cancer getting fatal. Yes, it is a cancer that can get fatal. It's the fourth most common cancer in women in India, and 1/5 of the global cases reported from India in terms of the total number of cervical cancer cases across the globe. 1/5 comes from India. So 1.2 lakh cases reported from India, 67,000 deaths per year. And if we look at the data from 2018, over 6 lakh cases reported worldwide. Over 3 lakh women died worldwide because of this cancer. So the symptoms of this particular disease of cervical cancer is the following: increased vaginal discharge, pain during sexual intercourse, bleeding after intercourse, excessive menstrual bleeding, bleeding after menopause, and persistent pelvic or back pain. So this is something that we have gleaned through the research team in terms of the basic information, but we will have experts on the show to tell us more about it. On the issue of whether there are treatments available, on the issue of what kind of signs and signals that you should be looking out for, all the important information coming up here on the show. So let me welcome, joining us today, Dr. Prashant Mehta, oncologist and senior consultant at Amrita Institute of Medical Sciences in Faridabad, Dr. Meenu Walia, senior director of Medical Oncology Department in Max Hospital, Dr. Ishwar Gilada, Secretary General in Organized Medicine Academic Guild, OMAG. Very warm welcome to the three experts. Really looking forward to an enlightened conversation on this particular news that we are breaking to our viewers today. First to you, Dr. Prashant Mehta. As an oncologist, you would have encountered cases of cervical cancer. If you can take our viewers through how significant a breakthrough you feel this is for India and for the world at large to have a vaccine that could prevent cervical cancer.
So I consider this a very big and important day for patients in India and in the whole country as well as the whole world. Most importantly, not because it's the first vaccine, but it's an indigenously developed vaccine. It speaks volumes about the capability of research in India, and also it is going to be affordable, much more affordable than the previous two or the third vaccine, which is the Gardasil 9. So it is much more affordable than that, and more patients will have access to the vaccine, because having therapies, having strategies to prevent cancer, having strategies to cure cancer make no sense if they are not accessible for the common man. And this is a vaccine here in India, homegrown, which is accessible, and it means a lot to all of us, to everybody in the oncology community, the whole nation and the whole world actually, because we are here as researchers also now. We are making our presence felt in the whole country and the world. And this is a vaccine which India presents now to the world for preventing an important cause of cancer and an important disease, and preventing deaths and saving lives. So, India is a big thing for India and our country and our countrymen.
Mm-hmm. Dr. Meenu Walia, in my understanding, sure, it is a big leap forward in cancer care, in preventive care. But, what about the fact that there will have to be enough awareness about it? In terms of how people are aware, even before this vaccine came into being, were there enough awareness about cervical cancer? What has been your experience so far in dealing with this ailment?
So I think awareness...
This was a question to Dr. Meenu Walia. Go ahead, ma'am.
So I'm so sorry.
So you're absolutely right. The awareness about this vaccine has been there, but to a limited extent. It is not all across the country and all across the various classes or all across the masses. But I know since now that it is in a way game changer for Indian cancer patients or Indian the scenario of cancer treatment in our country. So with this now homegrown indigenous vaccine now available and at a much more affordable price to whatever we had so far two vaccines, but they were both through like foreign companies, and the price was also much more than what we are now expecting for an Indian vaccine now. What has been announced is probably to the tune of just 200, 400. And I will not be surprised now that vaccine part of our national immunization program. So which was so much the need for all these years. And with that also the awareness level is going to change. So once it is a part of the national immunization program, all the girls, the school-going girls, maybe the government take up this thing, and the awareness also increases in vaccination at a mass level because of the affordability also in part that the government that will play in getting the people vaccinated.
Yes. So let's listen in to Mr. Adar Poonawala before we go to our next guest on how he perceives this particular breakthrough. He's the CEO of Serum Institute of India, the vaccine makers. Here's what he said.
When the government of India will induct this in a few months in the national program, and in a few months the vaccine will be launched, and I can assure everyone it's going to be very affordable. It's going to be substantially lower than what is available today, from manufacturers across the globe. So we can look forward to that. कुछ महीनों में हम announce करेंगे, शायद 200 और 400 रुपये के बीच हो सकती है, बट ये सब फाइनलाइज हम बाद में करेंगे गवर्नमेंट ऑफ इंडिया के साथ डिस्कस करने के बाद.
Dr. Ishwar Gilada, a couple of points made by the previous panelists about affordability, effectiveness. Dr. Meenu Walia calls it a game changer. As somebody who studies organized medicine, how effective do you think, as a policy, to have a nationwide program, is that what you think, is necessary after the first step of course, announcing and launching this vaccine?
Yes, in fact, this is a golden day in our history. India has been a vaccine and pharma powerhouse. And for last several years, we have been telling those two companies that you make the cost affordable, because your price currently the vaccine is available for 3,900 or another one is a 5,900 per dose, and 3 doses has to be taken. So how many people can afford that? And every year they have been increasing the cost rather than decreasing the cost. We have been telling them that you have recovered your R&D cost from your own countries, rich countries, Europe, America, Australia, New Zealand, Canada. Why you are recovering the same cost from us? They were not listening. I have been appealing the Indian vaccine industry that please bring this vaccine. We need it very badly. Whether it's a pneumovax vaccine, whether it's a HPV vaccine, whatever vaccines are not made in India, we should break the world record. We should make it provided to the people. Currently, 92% of the world's HIV positive people are taking Indian medicine. 80% of the vaccine supplies from India. So if the vaccine is being cost at about 5 to 10% of international cost, I think this is a game changer. And about efficacy, there is no doubt about it. Initially, 10-15 years before, people from abroad used to say, "Sasta ka maal raste." India doesn't have that kind of efficacy. They have taken samples of Indian medicine, analyzed in their lab, and they kept quiet. They kept quiet because they did not find any impurity. So they cannot talk about efficacy. let us talk about cost. Everything will in India depend on the cost. If the cost is affordable, people will take it. As a clinician, we are seeing lot of cases of either cervical cancer, penile cancer, anal cancer, oral cancer. There is a Tata Hospital study to show that 50% of the oral cancers are because of HPV, and HPV is a preventable cancer. Similarly, hepatitis B, which is a preventable cancer. So I think we should focus not only on COVID or HIV or something which is already happening, but on those things which are neglected. And COVID has taught us one thing, that there are vaccines also for adults. Initially, people used to think that vaccine means only for children. There are 9 to 10 adult vaccines. Some of them are made in India. Let us celebrate this day and really congratulate Department of Biotechnology and Serum Institute for making another game-changing day in the history of medicine in India or globally.
Yes. Yes, this is important. Now, I want to put out certain important information for our viewers, since I have two senior doctors from the oncology department on the panel, Dr. Prashant Mehta and Dr. Meenu Walia. I want you to take our viewers through, certain important things that they should look out for now that there is a vaccine available. What are the symptoms when we talk about cervical cancer? Dr. Mehta, you first. What is the important information? We are going to use this program also to create some awareness about this disease. So can you tell us what are the typical symptoms that women should look out for?
So yeah, the most common symptoms which we see in our practice is, having some abnormal vaginal discharge, having vaginal bleeding, and sometimes postmenopausal bleeding and postcoital, pain and discharge and bleeding. These are the common, and sometimes there is low backache and lower abdominal pain and discomfort. And sometimes when patients have an advanced disease, sometimes the kidney function can also get affected. Patients can have a swelling in their feet and swelling on the body. So these are the common symptoms of cervical cancer.
Yes, Dr. Meenu Walia, anything that you would like to add to it, and anything that you want to tell the women in this country, since you would have seen a number of cases, what should be the level of awareness about, and what is the first step that a woman needs to do if the symptoms, as Dr. Mehta mentioned, are noticed?
So, Shan, these are the symptoms of menstrual bleeding. Intermenstrual bleeding or post intercourse or offensive vaginal discharges, lower backache. These are all the symptoms that may indicate that yes, something is wrong and one needs to be tested for cervical cancer. Other things. The most important message that I want to give to the women of our country is it's a big thing that we have now a vaccine for cancer. So cancer is a disease where we all know we are afraid of. We all know that it is something that we need to be bothered about. So to have a vaccine for a disease, and now that it is affordable, we should take the onus on each one of us should take the onus to spread the awareness about the disease, because this is one disease that even now, in spite of a vaccine being available for quite a few years, although I agree that it has been much more expensive, and in spite of the screening tests, this is a cancer which can be picked up early also. But because of the lack of awareness, not many women come forward to get themselves screened for cervical cancer so that it can be picked up early in earlier stages. And in cancer, the entire thing is about the stage.
Yes,
so
the early detection, as you mentioned, and of course, now with this awareness, if people can take the step forward, they can prevent something like cancer. Why would you not do it? So as Dr. Meenu Walia says, the onus is on each one of us to know about this and to spread awareness. But on the age factor, Dr. Walia, is there a particular window that a woman needs to take this vaccine in? And what if we cross that age limit?
So the recommended age group is 9 to 26 years of age. So that is what is the worldwide. although the best is earlier than 15 years of age. So 9 to 15 is the best, because then you need to take only 2 doses of the vaccine. After 15, a lady needs to take 3 doses of the vaccine. So 15 to 26. So the best part is, the best way to take vaccine is before the starting of sexual activity, because human papilloma virus infection generally is gained through the sexual activity. So before a lady gets married or before the starting of her sexually active life, one should try to get the vaccination done. Yes, there have been reports that it has been found safe even after the age of 26. So there are reports that it has been found safe even till the age of 45 years of age. But once the sexual activity starts, then one expects that there may be already some HPV infection, and the preventive role of vaccine then decreases.
Okay.
So it will not prevent. If you have already acquired it is not effective against if you have already acquired the infection.
Okay, that's the clarity we wanted, and I hope our viewers would benefit from this useful information. Before I go to Dr. Gilada, I want to bring in my colleague Pooja, who has with her the statistics. We have to understand how prevalent is it in India. Pooja has all the numbers. She's done the number crunching for us. Over to Pooja.
Yes, well, absolutely. First of all, pertinent to note that this is a big shot in the arm for India and all the women out there. Of course, cervical cancer being the second most frequent cause of cancer amongst the women in India and the fourth most common worldwide if we talk about the stats. Not just that, in fact, breast cancer still continues to be the first most common cancer when it comes to the women of India. And finally, after COVID, in fact, there has been massive awareness when it comes to the vaccines and the preventive healthcare. Talking about the data here, of course, every year, in fact, as per the data, India accounts for over 67,000 deaths owing to cervical cancer. Not just that, in fact, more than 1 lakh, close to 1.2 lakh cases of cervical cancer are reported every year. So definitely this is, like I said, a big fillip when it comes to the healthcare for women. And important to note, in fact, that today only a popular prominent vaccine maker, Serum Institute, and its chief, Meenu Walia, in fact, confirmed that the scientific completion process of this vaccine is done now. All eyes are set on few months from now, which is going to be mostly by the end of this year, when finally this vaccine, HPV vaccine by the name Cervavax, will be rolled out. And the good news here is for every woman out there that these will be rolled out at quite affordable prices, ranging from 200 rupees to 400. However, the most effective age to administer this vaccine still continues to be from 9 years to 15 years. However, even post that, if you ended up missing your vaccine shot, you can always go on to take it even after the age of 15, that is till 26. However, there's more research and study that is needed when it comes to if pregnant women who are expecting babies, and if those who've crossed the age limit of 26 can also take this vaccine. But however, as the research and studies continue on the efficacy and the safety of this vaccine, definitely like I said, it's a big boost to the healthcare, especially for women. Finally, we have a weapon against the cervical cancer in India.
Thanks, Pooja. Thank you so much for giving us the figures and also for pointing out that there could be more research on the efficacy, and we will know more eventually. Dr. Ishwar Gilada, what are your thoughts on how this should roll out in India? And this is a diverse country. It's in the urban areas, there's greater awareness. What about women in the far reaches? What do you suggest that the government of India should do to make sure that this is available, accessible, and affordable for all?
See, first and foremost, we should tell people that there are two cancers very common in women. One is a breast cancer and one is a cervical cancer, and both are preventable. One is preventable through vaccine, that is cervical cancer, and one is preventable through self-examination and early detection. But people are not aware, and therefore we are losing so many women to both the cancers. Secondly, this vaccine is not only for women, it is also for the men, because 97 to 98% of the women get cervical infection through men. So what government should do is 9 to 15, they should provide free, because it is only 2-dose vaccine, and that should be everywhere. So it should be part of the common immunization program or universal immunization program, which also included hepatitis B vaccine since 2011. Thirdly, like every family gives something to their daughter for marriage, they call it Stridhan. Rather than Stridhan, they should provide vaccination. They should provide HPV vaccination, hepatitis B vaccination, so they are not getting those infections, and those infections can turn into cancer. And lastly, the adult vaccination has to pick up like all other things. People do usually annual maintenance contract for their air conditioner, for the cars. There is no air kind of contract for their bodies. They should look after the bodies properly. And as we said there, that women get vaginal discharge. But vaginal discharge are so common. 40% women will have any kind of discharge. So we should have a common mechanism to test them with a pap smear, and particularly also prevent through vaccine. So there are two things. One is medical science will continue to grow, but at the same time examination is important. Your self-suspect is important. Before you step into sexual activity, what are required to be done is also important. And despite all that, using protection by way of condom is also important. So vaccine will prevent you only from HPV, but using condom will prevent you from 20 other STDs, which are also very common. And HPV is one of the most common STI globally, not only in India. So what figures you are getting, 1,40,000 cases or 67,000 deaths, they are truly underreported because most people do not report. There is no reportability mechanism where every case has to be reported. So these are only tip of the iceberg.
Yes, parents must be aware, and then of course this will be possible. I urge parents who have young daughters to listen to our experts carefully and follow their advice. This is with regards to your health and fitness. Closing comments, Dr. Prashant Mehta. I think all panelists have agreed on one point, that early detection, early treatment, vaccination can of course prevent. But to both the other oncologists, Dr. Prashant Mehta and Dr. Meenu Walia, closing comments, Dr. Mehta.
So I completely agree with Dr. Ishwar actually that this is a very important vaccine, and all vaccines are important, and screening is also important. But I do agree that it is not only the women and the girls who should be recommended the HPV vaccine, but also the men and the boys, because it's a chain of transmission which needs to be stopped. Not only the women, the boys actually transmitting it, and also this vaccine has potential to not only prevent cervical cancer, but also some other cancers like penile cancer, anal cancer, and also oropharyngeal cancers. So it is still, if it is a universally used vaccine by the government of India, there is potential to save even more lives than it is presently intended to do.
That's a good point. Dr. Meenu Walia?
So I would just want to say that we all need to be aware that this is a cancer where in our country, even now, one woman every 8 to 10 minutes dies because of this disease. So it is high time that we go for preventive treatment and early screening, and prevention is definitely better than cure. So for prevention, the answer is vaccine. We have it now. So all we may talk about the side effects of vaccine, and so many times when we talk about vaccine, there are so many people who will come and say what are the side effects and what complications. So all said about the side effects are very minimal, and at the end of the day, always prevention is better than disease. If we prevent a disease, then nothing like it. And for all those ladies who might have missed the age for vaccination, and for them whom I say the sexual activity has already started and whatever, and probably they are not candidates for vaccine, even for them, this is not the end, because why? They should be aware that.
All right, I lost the audio link with Dr. Meenu Walia, but I think this is extremely critical information that all three experts have shared on the program. The idea is, of course, to save lives. The idea is to prevent cancer, and not just one, multiple different measures that the experts spoke about on how to prevent cervical cancer. Really appreciate Dr. Prashant Mehta, Dr. Meenu Walia, Dr. Ishwar Gilada for joining us here on the program this evening. Thanks very much. Let's take a short break. When we return, AAP MLA staged protest